Welcome to today's lecture on non-renal routes of drug excretion. So, in this topic, we are going to discuss about what is excretion, what is non-renal excretion, and what are the various non-renal excretion process. So, coming to what is what is excretion? So drugs and or their metabolites are removed from the body by excretion process. Excretion is defined as the process whereby the drugs and their metabolites are irreversibly transferred from internal to the external environment. The principal organs of excretion are kidneys. So what is non-renal excretion? Non-renal excretion is nothing but excretion of the drugs and their metabolites by routes other than the kidney is known as non-renal excretion. So what are the various non-renal excretion processes? So there are 7 different types of non-renal excretion processes that includes biliary excretion, pulmonary excretion, salivary excretion, mammillary excretion, skin or dermal excretion, gastrointestinal excretion, genital excretion. So coming to the biliary excretion, this is very important process. Biliary excretion involves active secretion of drug molecules or their metabolites from hepatocytes into the bile. The bile then transports the drugs to the gut where the drugs are excreted. If the drug has favorable physicochemical properties, it can be partially reabsorbed from the intestine back into the bloodstream just like an orally ingested drug. Since bile is an aqueous solution, it is soluble for dissolving hydrophilic drugs. In addition, bile acids allows solubilization of lipid soluble drugs. Thus all the types of species anionic, cationic drugs, polar and lipophilic drugs can be secreted into the bile. The compounds that are excreted in bile have been classified into 3 categories on the basis of their bile plasma concentration ratios. So, group A is compounds whose ratio is approximately 1. Examples includes sodium, potassium, chloride ions and glucose. The group B is compounds whose ratio is greater than 1, usually from 10 to 1000. Example is creatinine, bile salts, bilirubin, glucuronide. Then group C is compounds whose ratio is approximately less than 1. So examples includes sucrose, insulin, phosphate, mucoproteins, phospholipids. Then coming to the factors influencing biliary excretion. So there are 3 different types of factors which are influencing the biliary excretion. That is, the first one is physicochemical properties of the drugs. In that one, molecular weight below 300 daltons. So there is a less than 5% is excreted in bile, and above 500 daltons excreted mainly in bile. Between 300 to 500 daltons excreted both in urine and in bile. Then polarity, greater the polarity, better the excretion. Metabolites are more excreted in bile than the parent drug because of their increased polarity. And the next factor is nature of biotransformation process. Drugs which undergo phase 2 metabolism result in metabolites with increased tendency excretion. Examples like morphine, chloramphenicol, indomethacin. Then the other factors like sex and species differences, protein, drug binding, disease state, drug interaction, route of administration. So these are all the other factors which influence the biliary excretion. Then coming to the next excretion process is pulmonary excretion. Gaseous, volatile substances such as general anesthetics that enter the body primarily through the respiratory tract can be excreted uh, to be excreted by this route. No specialized transport systems are involved in the excretion. Simple diffusion across the cell membranes is predominant. Example is halogen. Then coming to the salivary excretion, excretion of drugs in saliva is a passive diffusion process. Unionized lipid soluble drugs at pH of 5.8 to 8.4 are excreted passively in the saliva. The bitter after taste in the mouth of patient on medication is an indication of drug excretion in saliva. Examples like lithium and phenytoin. Then mammillary excretion. So mammillary excretion of the drugs in milk is a passive process and is independent on pH. Then molecular weight, lipid solubility, degree of ionization. Free ionized lipid soluble drugs diffuse into mammillary alveolar cell passively. Examples like chloramphenicol, propyl thiouracil, methadone. These are the some of the examples. Next, skin or dermal excretion. Drugs excreted through the skin via sweat follow pH. This can lead to urticaria, dermatitis, hypersensitivity reaction. Examples like benzoic acid, salicylic acid, lead, alcoholic, arsenic, mercury. Then coming to the gastrointestinal excretion. Excretion of the drugs into GIT usually occurs after parenteral administration. When the concentration gradient for passive diffusion is favorable, water soluble and ionized form of weakly acidic and basic drugs are excreted via this route. Examples like nicotine and penin. And the last type of non-renal excretion is genital excretion. Reproductive tract, genital secretion and semen may also contain the excreted drugs. Example propranolol. Thank you.